Dear students and doctors, I'm Kim Zhen, behalf of Division of General Surgery, Kaohsiung Chang'an Memorial Hospital. I am the fourth grade chair-president of General Surgery. Today I will like to spend a few minutes to introduce our division. Please feel free to contact us via telephone or email if you had any question. First, as you can see, there are a few different branches we developed, which including hepatobiliary part, GI, surgery part, and breast, thyroid, and we also had trauma and emergent surgery, and surgical ICU. The first one I have to mention, might be the most popular in our division or in our hospital. The liver transplantation. We have the largest number and best survival rate in Taiwan, and we also the only training center in Taiwan recognized by the world famous Henry Bismuth Hepatobiliary Institute in France. Generally speaking, we will arrange about 2 to 3 liver transplantation operations per week. So as long as you want or if you are interested, you have not to worry about missing a chance to see this kind of operation. And also, by the way, the pediatric liver transplantation because of pediatricia is also performed in our division. Then thank you for the experience of the liver transplantation. We also had a mature system to deal with different kinds of liver disease, which including hepatocellular carcinoma, cholangiocarcinoma, liver cyst, or different kinds of metastasis. We have also developed minimal invasive operation for many years. And talking about the localization of a liver tumor, we have intraoperational sonography and the ICG, which is known as near-infrared fluorescence, to help us recognize the tumor and the most important, the tumor margin. This kind of tool will help us avoid post-operation liver failure. The following is gastrointestinal surgery. We manage about gastric cancer and gastrointestinal stromal tumor, aka GIST. Besides this part, we also had some special gastric surgery, bariatric surgery, which help us in some indication such as obesity or diabetes. There are future food kinds of operation in our hospital, include roux and white gastric bypass or sleeve gastrectomy. The next one is breast surgery. Although the surgical intervention is less important with improvement of medication, there are still some patients need this kind of operation. So besides, we also still develop the laparoscopic mastectomy step by step. Just hope the patient has a smaller wound. And we also combine with division of plastic surgery for the post-operation reconstruction. We hope to keep patients' life quality and treat the disease at the same time. The next thing I will introduce is the thyroid surgery. We have the largest case number per year in South Taiwan and the second place in the whole Taiwan, just lower than National Taiwan University Hospital. Besides the traditional operation method, we also collaborated with radiology to develop radio frequency ablation (RFA) for a smaller nodule. For those who hope to avoid scar, we also have optional choice, transosal oral thyroidectomy. The skull will be hidden in the oral cavity. There will be no scar on the neck. Just as I mentioned, we care about the patient's life quality as much as they did. Although the pancreatic surgery case number is not so many, but we are still capable of different kind of operation, no matter laparoscopic or laparotomy. We also perform a surgical intervention for chronic or acute pancreatitis. The regular combined meeting for the pancreatic cancer is held once a week. The next part is the unique part. We have our own emergent surgery department managed by the oral surgeons. We are responsible for different kind of emergent surgery, which include blunt abdomen trauma, liver laceration, spleen laceration, ischemia bowel, perforated pectic ulcer. And for those who had abdominal cancer with carcinomatosis, we also have experience of HIPEC, hyperthermic intraperitoneal chemotherapy, which cooperate with Department of GYN and Division of Proctology. About the intense care unit, we have the surgical ICU for the post-operation management and traumatic patient. General surgery involve multiple organ frontal tail. If you are interested about surgery but you haven't decided which specialty to major, you are more than welcome to visit our division. Just like Hippocrates said, the life is so short, the craft is so long to learn. It doesn't matter which hospital you visit, as long as you learn what you want or what you really want. After this introduction, I don't know if you have any question to ask. If you have any question, please feel free to contact us. That will be all introduction for today. Thank you for your attention.